It's important to remember that poor sleep is considered a risk factor for cardiovascular disease, and poor sleep could be too much sleep, not enough sleep. The general recommendation is for 7 to 9 hours a night, although it can be a little bit different for everyone. And then also, if you're having a lot of disrupted sleep, like you're waking up a lot at night, all of those things can be fall into the category of poor sleep and be a risk factor for cardiovascular disease. And the reason that is because when you're sleeping poorly, it increases your stress hormones, and that can impair your sympathetic nervous system activity, which can impact your blood vessel function, and that impacts, risk factors for developing cardiovascular disease as well as cardiovascular disease, things like high blood pressure, diabetes, and then as well as can mess up your circadian rhythms, which can impact inflammation in the body. And so all of these things can increase your risk for developing cardiovascular disease long term. And so that means over, if you're having poor sleep here and there, it probably won't make a difference. But if it's like most days, every year, over time, then it is something you should work on. And, there are a lot of ways you can do it yourself. There are a lot of videos and, on YouTube and blogs and things like that about how to improve your sleep. There's also sleep trackers, which are supposed to be around 60 to 80% accurate. So that can help a lot. And then there's also sleep therapists and sleep doctors you can go to if you need like a sleep study, depending on what kind of help you need. And so there's a lot of help out there, but definitely if you are consistently having trouble sleeping, it is a risk for cardiovascular disease. So it is something you should look into working on.